So let's introduce yourself at first.
My name is Gene Pavlovsky. I'm a veterinarian, and I've been practicing veterinary medicine for about 11 years now.
So where did you graduate?
I graduated from Ontario Veterinary College, which is in the city of Guelph. It's associated with the University of Guelph. It's in Canada.
Okay, so you're Canadian.
Not Canadian. That's just the school that I went to.
Okay, so how did you decide to start with this major and then start with this job?
I've always liked animals. I have some doctors in my family, and I wanted to combine medicine with my love for animals, and eventually got to the point of wanting to go to vet school.
Okay, so how do you feel about your 11 years of working with animals? Is there any special experience that you remember, like with special animals?
I generally see dogs and cats. I occasionally see other species, mostly small exotic mammals or birds or snakes. Special experiences. I guess when I was in veterinary school, I helped to take care of a giraffe that came from Toronto Zoo, which was quite a special experience. It's not something I've done before. Since then, even though I only see cats and dogs mostly, my interaction with them and their owners is very different each time, and so each individual case is very different, and it helps to have had the 11 years of experience, because I can now be much more comfortable with lots of various disease conditions and be able to help them.
Okay, and we know that most pets they only recognize the people they know, and when they meet you, you're like a stranger.
Mm-hmm.
Then do they just like feel anxious, and how do you get along with that? Any special tricks?
Yeah, it's a good question. This environment of a hospital can be scary. It smells funny. There are noises that pets aren't used to. We learn to read their signals. We learn to try to determine if they're scared or stressed or anxious or aggressive towards us, and then we modify our approach based on how they appear. We try to lessen their stress by sort of less invasive handling techniques. We use a lot of food to motivate them. We have things like towels, for example. If a cat feels uncomfortable or scared, we can cover her up with a towel, which would make it feel a little bit better. We try to take the least stressful approach as we can, because we can get a lot done that way without increasing their level of stress and fear.
Okay, and what kind of disease or conditions that most pets come for?
Well, there are common conditions that both dogs and cats get. Among the most common are dental disease. It's very, very common. Just about 80% of dogs and cats over the age of 3 get some form of dental disease. Obesity, being overweight, is very common. Arthritis, especially in older pets. Conditions like skin infections, allergies, ear infections, various intestinal problems are sort of at the top of the list. And recently we've seen more obesity-associated problems like diabetes, especially in cats.
Did they just eat too much?
Well, they gain weight, they eat too much, and diabetes can develop as a result of that, just like in a person.
Okay, then any special disease, like you seldom meet?
What disease?
Like, do you ever see any like rare disease?
Rare diseases? Well, I can't think of anything super rare that I've seen, but there are reports of relatively uncommon diseases that creep up around the country. Like there was a case of plague that was diagnosed in Colorado recently. Plague is a bacterial disease carried by fleas that can be deadly to people. We've seen cases of distemper in dogs, which are pretty rare these days because it's most dogs get vaccinated for it. there's occasionally there are some rare diseases that come up, but most of the time we deal with fairly common problems that occur on a regular basis.
Okay.
All right, well, we can come back over here. Come on, buddy.
Okay. You can just go ahead and do whatever you want.
Okay, well, we'll go ahead and examine this puppy here. Good boy, good boy. All right, we're going to take a look at your eyes. Let's see what they look like here. Come here. Good boy. We'll take a look at your teeth, which are very nice and white. And ears. He's very interested in what you're doing. All right, let's feel your belly. Let's take a look at your skin. This is a husky, and he's in pretty good shape. He's not overweight, he's not underweight. He looks great. Listen to your lungs. And you're very well behaved. Well, his heart and lungs sound good. Come here. Come on. Good boy. Sit. Good job. So when I go through a physical exam, I take a look at all the external organs, take a look at his skin and eyes and ears, and listen to his heart and lungs. Take a look at the teeth and eyes, feel the belly to make sure everything is normal. We also take a set of vital signs, heart rate and respiratory rate, temperature, to get an idea of his status. But he looks great. He's a very, very well behaved husky, which is usually not the case. He's a very good boy.
He's so cute.
Right? You are cute, yeah. He's a good boy.
So excited.
He's very, very handsome with blue eyes. Right?
And why is here for why does he come here?
He's here just for a general exam.
Oh,
We
okay.
schedule them every 6 months. They always come in for their wellness exams to make sure that there aren't any problems that are creeping up. And he's just turning 1 pretty soon and heading off into his adult years. So we want to make sure he's set up for success here.
So cute. Thank you. Okay.
All right,
Take
buddy,
it.
let's go.